finding a job and a place to live, like Maslow's hierarchy of need. Health is next. Health is definitely top of the list where people are going. But a lot of the times we kind of rely on the healthcare system where we are from. So the key thing today is kind of to shed more light and insight. No one is a salesperson who's going to speak, but it's just to give everyone a bit more insight about what the healthcare in Ghana is about, and then also opportunities for you to answer a few misconceptions that they have. I had a neighbor in Ghana who the mum thought that if you go in an ambulance, it was basically you dying, because I think she had heard a lot of stories about people dying in ambulances. So her son desperately needed to take an ambulance, and she said no, she refuses, because people only die in ambulances, which is, I think, a negative thing to say, but it's just based on her own personal experience. I'm just going to introduce Effia, Dr. Effia. If you want to introduce yourself, tell us a bit about your journey becoming a doctor and your experiences working in the hospitals in Ghana. So over to you, Effia.
Okay, hi everyone, good evening. My name is Ifwa Thompson, or Dr. Thompson, or Ifwa Danka Smith. I go by any of the names. So I previously worked for a year at Kolebu when I finished medical school.
You're muted.
I just realized. Sorry, can you hear me now? Can you hear me now?
Yes, I can.
Yes,
we can hear you.
Okay, Jackie, what was the question again? I'm sorry.
No, just to introduce yourself and tell us a bit about your journey into becoming a doctor and what it is day to day as a doctor in Ghana.
Okay, so my name is Dr. Ifwa Danka Smith. I have been working as a doctor for a year now. I went to University of Ghana Medical School, but I did my first, you know how in Ghana or like in the States, you do your first degree before you go into medical school. So I did that in the States, and then I moved back to Ghana for medical school. And so I worked at Kolebu, and then I'll be moving on to work at another government hospital in the next month. I'm home now on maternity leave. Yeah, basically, that's me.
What do you specialize in, or what's your, as a few years into your profession, how does it work in terms of where you start and then how you specialize?
Okay. So how it works is, for now, I have to work in the 4 major fields, and then we have to work, that's for 2 years, and then we have to work an extra 3 years practicing in those fields before we can actually specialize. So I just finished with the first year of that. So I did pediatrics and general surgery, and I'm hoping to specialize in obstetrics and gynecology when I'm done.
I'm going to pass over to Dr. Kweku. He's Kweku, who is in America, but he was a doctor in Ghana as well. So Kweku, if you can introduce yourself and your journey into medicine, and also what you practiced in whilst you were in Ghana.
Okay, so I'm Dr. Usu and Kweku Usu. And I finished medical school in 2015. I actually trained in Ukraine. And afterwards, I moved back to Ghana, sat for the Ghana Medical and Dental Council examination, passed, and then did my housemanship training. So the housemanship training was 2 years. Did first year in 37 Military Hospital, and then the second year was at Ridge Hospital. So afterwards, I was doing locum here and there till I moved to the States. Yeah, so basically that has been my journey.
Thank you. I'll just head on straight to it. So, like with whether it's teaching, education, or with medicine, there's always a universal ranking and stuff. I think it's called the Bloomberg Health Ranking. And sometimes you can look at it and think, eesh, Africa is quite low. But COVID has kind of proven that we've gotten something right. And it might not be at the end stage in the hospitals, which we can't, verify, but we have something right, and this has definitely proven it. But there are a lot of misconceptions around people not trusting the healthcare system. So I wanted to know why you think that is. So if somebody, I used to teach, if somebody asked me why parents don't trust teachers, is because I would say maybe lack of communication, and lack of communication in the beginning with children, and saying, oh, your son is, bad from grade 5, in grade 5 when he's 10 years old, how can we help him, rather than at the end when we realize he's bad in grade 11 and things like that. So where's the misconception of Ghana has a negative healthcare system, or you don't hear that stereotype? So Effie, if I can.
Okay. Can you hear me? Okay, I think you can hear me. So with that, I feel like that comes a lot from people's previous or people's personal experiences of family members. And this is especially for people who haven't even had, who have family members in the country, in Ghana, and they live outside. And then they hear this and this happened, this experience happened, and the outcome of what happened, and then they sort of compare it to what they have experienced outside the country, and then there's like, it should be the same. If it's the same healthcare, they see a huge difference, and then so that's what builds up the mistrust. And we also hear a lot of things in the news, like not only with the healthcare delivery, but even the kind of drugs that are on the market. I think you mentioned to me earlier, and a lot of imitations of drugs, the kind of drugs that are imported, like more inferior compared to what people are getting outside. So it's a lot of things that are going around people's experiences, and some things do really actually happen. So I wouldn't say that it's all a lie or it's all over exaggerations.
I suppose nowhere is perfect. Moving on to the pharmaceutical side, if any of you can touch upon it. So I had an auntie who's a pharmacist, and she was saying her dad was given expired drugs. Where is the kind of quality assurance in Ghana, or must it be that the patient has to be very highly educated? So, for example, in this country, health in the UK, health is free. So therefore, sometimes they give you the most basic of the drugs. There might be 3 forms of the drugs, and they'll offer you the basics first. And then maybe if you have high blood pressure, then they'll offer you the above standard. And if you have maybe other conditions, they'll offer you the higher version, but they can't offer everyone the top end because of the cost. So, if you're highly educated in that, you would know and do research. Is that the case for when people are seeking the medicine in Ghana? How much should they be well informed with the treatment there? So, quickly, if you can answer that, Dr. K.
So I think the main problem in Ghana is that some people have their ways of importing substandard drugs into the country, but that doesn't mean that all drugs that are in the country are substandard, because there is a Ghana Standard Authority, and they make sure that all drugs imported in the country are standard. There's also the FDA, who also are into standards and make sure that all the drugs which comes into the country, comply with their regulations. But there are bad nuts everywhere. So you find people, able to beat the system and then order substandard drugs into the country. And what you spoke about concerning the health insurance in Ghana, we have there's health insurance. There's a national health insurance, and there are private health insurance companies. So with the national health insurance, not all drugs are covered under the national health insurance. So most drugs that are covered under the national health insurance are basic. They are basic drugs. So the basic drugs that we use for very basic, treatments. Those are the drugs that are covered under the health insurance. And obviously they use the generics, what you call the basics. So those are the drugs which are covered under the national health insurance. But if you have a private health insurance, which is expensive, which not everybody can subscribe to, that one you have the chance of getting some of the expensive drugs, or some of the drugs which are on top of the ladder, because what happens is that probability of you getting what you termed as the basic drugs to use. When you normally get those basic drugs, the likelihood of you getting a drug which is substandard is very high, unlike going in, for the so-called original drugs. Yeah. So basically, that's about it.
Okay, can I ask about so if I didn't have health insurance, what's the basic that you get in Ghana? So what's the basic healthcare that everyone is subscribed to, and is it a card that you must get? How do people subscribe to that?
So if you don't have any health insurance, being it public or private, if you don't have any health insurance and then you visit a health facility in Ghana, then it's more or less what we term cash and carry. So you automatically enter the cash and carry system. So you should have cash to pay upfront before the service is rendered to you. But even with the national health insurance, you should still have some cash to more or less, kind of pre-finance. Because it's not every aspect of the healthcare which is covered by the national health insurance. There are some aspects of the healthcare which is not covered by the national health insurance, especially with the labs. If you have to do, if you have to do labs, if you have to do imaging, most of those labs and imaging are not covered by the national health insurance. And the drugs which are covered under the national health insurance are basic drugs. So if you don't have any insurance at all, then it should be cash and carry system. Whether it's an emergency, whether it's a ordinary routine planned visit, you will have to, pay fully for the service.
Whitney's joined now. Whitney, thank you, Kweku. Whitney, if you could introduce yourself and also what you do in Ghana, please. Many thanks. Welcome as well.
Thank you. My name is on there already. My name is Whitney Boachimensa, and my day job is into events planning. I'm the managing partner for Innovations Events WBM, and on the side, I am the founding member for My Dear Sisters Keeper Ghana. It's a community platform for women and couples who are dealing with the stigmatization of infertility, miscarriages, stillbirth, and everything to do with it. I guess that's what we try to do. It's something I have been through. I realized that when I was, fortunately and thankfully, I have 3 boys now, but I realized that our system here makes it very difficult to access things like fertility treatments, psychiatric treatments, and these are all things that you deal with when you're going through infertility. So we have a group of community doctors who are top notch in fertility treatments, and we try to get discounted services for couples and women who want to do fertility treatment. So basically, that's what I do.
Thank you. Lovely to meet you. So if you're back to the question of, say for example, somebody hurts themselves and they come to your hospital, or if people have migrated to Ghana and they have like a quick emergency, what's the process that they do aside asking their family members or a local WhatsApp group? What's the first point of call that they do if they've hurt themselves and they need to go and see a medical physician on a Friday afternoon or something? Is there a number they call? Do they call their personal doctor? How does it happen? What's the process?
Okay. So it depends on the individual, but I would say the best thing to do from experience would be to go to the nearest hospital. They just implemented a new ambulance service, which you'd call 112, but you've had people, which was done maybe like 6 months ago, or even less, much less than 6 months ago, which was implemented by Akufo-Addo and all that. But most people's experience is that it hasn't been prompt. And then within the car itself, they don't have, or they may not attend to all the emergency things, like maybe oxygen, may not know how to do CPR. So that's what people's experiences have been. I have had just one experience and it wasn't an emergency. We just had to transport a patient. And even with that, when the people arrive, before they even take you, they would ask that, oh, we need some money for petrol. So I wouldn't even imagine in an emergency situation how you're going to have to deal with that. So my best advice would be, if you have a car or you can call a car, go to the nearest hospital. And if they can't sort you out there, they'll direct you to another hospital. You also can't just walk into places like Kolebu, or if you're in Kumasi, the KNUSC hospital. All those hospitals are, or the big hospitals are referral based. So it's always best to go to a hospital nearby, and then they will refer you to a bigger hospital. And the hospitals nearby should be able to attend to at least any sort of emergencies. And then we have, as he said earlier, it is largely a cash and carry system. So a lot of the places would attend to you, but then before you're able to leave the hospital, you should be able to settle your bill, or you sort of may have had some pre-arrangements with them. Like I know this private hospital, Akai House, some families have accounts with them. So they may go today, but they may not have to settle their bill today. But if you walk in there, before you leave, you have to settle your bill. And almost all, none of the private hospitals take the national health insurance. And even with the private health insurance, I don't know if you've ever noticed, if you go to any clinic in Ghana, they have all the stickers of the ones they accept. So all of them are not accepted everywhere. And just like you'd have in England, there are levels to it. So maybe if you're a gold card member, you can go to any of the top private hospitals, as opposed to if you were like silver or bronze, that kind of thing as well. So the national health insurance is for the public hospitals, the public clinics. And then some of those public hospitals also take the private health insurance. And then the private health insurance doesn't go to every private hospital. So you need to know if your health insurance is accepted somewhere else. So the best thing to do is have cash on you, because cash is definitely taken everywhere.
Crazy, cash is king. So then, if this sounds silly, but maybe if I knew how much something would cost, I wouldn't go to the doctor. I would treat, for example, with my child, she cut herself. There's alternatives of treating her with, natural medicine or local medicine. Is there a price list of what things are, or they tell you the price in advance? So then you're not owing. You don't realize that, wow, to give birth is $10,000 in Ghana. I could have done it elsewhere or something. Or maybe Naho clinic is 10,000, this clinic is 8,000. Are there options, and are those things readily available for people to know?
Sorry, go ahead.
Okay. So the cost of the healthcare service provided depends on the facility. So it depends on the facility you are visiting. So for example, all district hospitals, all public district hospitals, I mean, those that are under the Ghana Health Service, or district hospitals might be charging around the same fee for consultation, for surgery. They will have a standard range within which they charge. All let's say government regional hospitals will be charging around the same fee. All tertiary hospitals, even though the tertiary hospitals are a little bit autonomous, they are not really under the Kolebus, the Cape Coast Teaching Hospital, Confanoche. Even though they are under the Ministry of Health, they are not under Ghana Health Service. So they have a little bit of autonomy, and they kind of adjust their prices a little bit, and it might differ from one tertiary facility to the other. But the private hospitals, they charge based on, it's business, and they have to make money. So they charge based on how much they are, based on their facilities, and how much they are putting in to get you the healthcare service that you desire. So they charge based on that, and that is not really regulated. So it depends on the facility you visit. So we don't have a fixed charge that, or a website or something that you can just make a reference and then this hospital charges this one charges that, and then you walk into. No, if you really want, the government subsidized hospitals, the public hospitals obviously charge cheaper than the private hospitals. So generally, that's how I can put it. The public hospitals, they charge cheaper than the private hospitals. The private hospitals, some of them are really expensive. I mean, as my sister rightly said, if you go for fertility treatment in a private hospital, it's very, very expensive. So basically, that's about it.
If I can add with, as let's say a patient in a hospital, most of the time we have this perception here that if it's public, they do not give the best of care. Funny enough, until it is an emergency, and then we all run back to the public hospitals because they probably would have everything that you would need. But most people feel that when you go to a public hospital, i.e. a government hospital, the kind of treatment you will get there isn't the best. So they would rather go to a private hospital where they charge more to get the kind of treatment they want. So most of the time we do know that, I mean, it's expensive. Where I used for my babies, I remember somebody was complaining that just to see a doctor for antenatal treatment costs an arm and a leg. But you would choose that because if you will go to the public, when you're going to probably sit the entire day till it is your turn to see one doctor, and you probably do not have an entire day to do that. So most of the time, yes, we are very informed about prices, but because of the kind of treatment you will get, you find out that a lot of people will rather choose the private. Funny enough, the nurses, and especially the nurses and some of the doctors you're running from in the public hospitals who are probably not giving you the best of care, they come to the private side and you get the best of care from same people. It's funny how that works in this country.
Whitney, did you say the people that work in the private ones sometimes work in the public ones? I didn't hear that.
The people that work in the public one sometimes work in the private one.
Yeah.
Most of them do.
Yeah. So basically, it's the same crop of doctors. You know,
Exactly.
the same crop of doctors you find in
Yeah.
the public hospitals who, you know, after their normal 8-hour shift in the public hospital would go and do some locum in the private hospitals.
Yeah.
But you know,
Exactly.
it's all about, you know, the doctor-patient ratio in Ghana is quite high. I've forgotten the exact figure, but I know it's very high. I think it used to be one doctor to about 8,000 patients or something like that. I've forgotten. I don't know the real figure now, but it's very high. It's alarming.
If you compared it to another country, an OECD country, how does it compare? So if you compared it to Spain or America, so 1 to 8,000, how does it compare to other countries?
Yeah.
Yes. So I don't really have the figures now. But I know that Ghana's doctor to patient ratio really falls below the standard of what is expected by WHO. So we are way nowhere close to, I mean, what is expected to run an efficient public, you know, health system, or to run an efficient healthcare delivery. We are nowhere close to it. So the reason why I brought in this is that, so it's the same crop of doctors you find in the public hospitals or the government hospitals who would finish their shifts and then go to the private hospitals. But the comparison here comes in when, you know, when you go to the government hospitals, there's so much load. There's so many patients, you know. So, I mean, the doctors and nurses in the government who work in the government hospitals, they tend to get what they call compassion fatigue. So it's like they are no more compassionate to the patient because, you know, there's so much work for them to do. You know, you go to a ward of about, let's say, maybe a ward of about, let's say, 100 patients or 70 patients, and there are just about 3 or 2 nurses on an afternoon shift taking care of all these maybe 50 patients. And they have to feed them, they have to give them medication, they have to change their beddings, they have to probably dress wounds and everything. And there are only 3 of them. So you can imagine they wouldn't have they wouldn't have time to spend on one patient. You know, they wouldn't have a lot of time to spend on solely one patient because they have to take care of everybody before their shift is over and write a report. Nurses write a lot of reports. So afterwards, they need to sit down and write their reports before their shift is over. So, I mean, the only way, but when you go to the private hospital, it's not like that. Probably you have a nurse to about max maybe 2 or 3 patients, something like that. You know, so the numbers are less in the public, in the private hospitals than in the public hospitals. In the public hospitals, you go, like for example, you go to a government hospital. Let's say you are running an OPD, an outpatient department, for the day. You sit in your consulting room, and you know the pile of folders on your table, very huge. Maybe it runs into hundreds, and you're supposed to see all these patients in a matter of probably 6 or 8 hours. You know, so there is no time to spend on one single patient because you need to see all those patients before your shift is over. But you go to the private hospital, it's not like that. So private hospitals, there is time, for you to really, take your history, examine, talk to the patient. Some patients, they just need, tender loving care and they are fine. Probably they don't need any medical treatment. They don't need any medicines to swallow. They just need somebody to talk to and advice and all that. But you wouldn't have the luxury and the time in a public hospital to offer that because there is so much load. The volume of patients waiting for you is huge. So that's basically the difference. But to add to what my sister said, in the doctors and nurses in Ghana, they are very competent, no matter where you find them. Because the same doctors you find in the public hospitals that you meet in the private hospitals. So they are very competent. They know their job very well. And as she said, the private hospitals is more or less business. In the government hospitals, government is subsidizing. So they are not really into business. They are not really business minded because even if they run into a loss, government will bail them out. But in the private hospitals, not like that. You are paying full bills for your electricity, for water, everything. And the facilities that you bought to invest in the hospital, you have to recoup that money back. So in the private hospitals, it's purely business, and nobody will want to, no private hospital will want patients to come and die in their hospital. No, never. So they will admit the patient. Most of the private hospitals, they will admit the patient, take all your money from you, as in, as a doctor, there are some cases that when you admit, you know that this case is beyond the capacity of the facility in which you are working in. So you either just stabilize and then refer to a bigger facility to take care of the case. But some of the private hospitals, they will keep you there because each day you spend there, they are making a huge amount of money from you. So the end, when they realize that there's nothing they can do for you, then they will now ship you to a government hospital to go and die there, because obviously they don't want you to die in a private hospital and then give the hospital a bad name. That's why most people who visit private hospitals end up finally in the government hospital, and probably when they come, it's very bad.
Oh, when it's those stories. Okay, thank you for that. If you can keep your questions coming. Sorry, you talk, or was it?
No, what I was going to say was exactly the last thing Kweku said, that a lot of the time you start in the private hospital and end up in the public hospital. And the thing is, because in the public hospitals, there's like everything. So say I come in with a gynecological problem or an obstetric problem, I'm doing a surgery and then I need to go to an ICU. The ICUs in Ghana and the public hospitals. And so we find patients who are coming from, say, like Lister to Kolebu to be seen in our ICU, but then they weren't originally seen in the public hospital. And then within the public hospital, you have all the specializations or specialties available. So that's like kind of where the advantage comes in. So if you are being seen in a public hospital, you have all the range of doctors to see to you. But then if you're in a private hospital, you'll be seen there, and then you have to be moved on to the public hospital. So you still kind of get the public and the private.
All right, that's interesting. Please do keep your questions coming. I wanted to talk to Whitney about, by God's grace, if you're a healthy woman, the only time you often see the doctor is through childbirth and, you know, that whole fertility journey. And then Effie, I'll touch upon insurance later. But with the UK, I think there are certain, you get a support with fertility up until a certain limit. So if you need IVF support, I think they'll give you one trial for free, and then the rest you have to pay for, and things like that. So in Ghana, how does a woman that's, you know, a partner there having a fertility journey, how is it with the options they have available? Do they have like a variety of options? What happens when IVF, which is probably the first point of call, is it the first point of call? What happens when that doesn't work, and what's the care like? So the emotional side, the psychological side of it all, how is that managed and supported with the women you work with in Ghana, Whitney?
Again, I started Sisters, my dear Sisters Keeper, because of this. I realized that, and not just for me, but for a lot of women, first of all, you do not get any kind of support like you will get in the UK. If you're doing fertility treatment here, you pay from scratch till finished. You do not get any kind of support with it. Secondly, unfortunately, our society makes it look like if you even are doing fertility treatment, you carry and you miscarry, or you give birth to a baby born sleeping, you cannot even mourn that loss, because there's a belief, funny enough, if the loss of that, there's a belief that you're kind of sucking your other babies from not coming into your womb. So we found out that for we found out that for a lot of the women, even when they go on to have rainbow babies, they sort of live with the guilt and the emotional trauma of the ones that they were not able to carry initially. So we started, we are fortunate to have a community psychiatrist who takes on the women we recommend from the community, and they give them next to nothing services. This is what we do, but for a lot of people, they do not get. And we kind of look at psychiatry, psychology, mental case in this country as you're probably crazy. That's why you're seeing a psychiatrist. So we tend to look at it funny. But we explain to a lot of these women that, I mean, on a daily basis, everybody needs that kind of service as well. So that's what we do. But on a larger scale, as in the public, the typical Ghanaian, there is no such support for anything like that. Nothing.
Right. So with I can only speak for the UK. There are charities available similar to yours. How accessible is it to women who don't have enough money? How, if they're struggling with fertility, what are the supports for them? Or say, for example, you're in the UK, you could potentially be on different drugs that are free. So if you move and migrate to Ghana, must you then, is it a case of it's actually better to do your fertility journey in the UK and then come to Ghana?
Yes. It is better. It is.
Astounding, yes.
It is better if you do it there than come over here. It's there's nothing, there's no kind of support here for anything like that, unless of course you have the means or the funds available to do it here. But what we're trying to do is we have a few programs lined up that we want to do, a fundraiser for some of the women. But you see, we look at it also here as, if you want to have a child, it's your prerogative. It's not somebody's prerogative if you want to have a child. So support is looked at in a funny way. But for those who understand, for us, even for our meetings and stuff, we get support from donors who have been through the journey, so it's easier for them to say that yes, because I've been there, I will support this. But as a system, no, there's nothing like that. Ghana hasn't, we are not there yet.
Yeah, so in addition to what Whitney said, the national health insurance policy that they have in Ghana doesn't cover IVF. So I mean, there are various forms of fertility treatment, but you know, the most popular, or let me say the most widespread, or is the IVF. But there are various of them. There are various kinds. But the IVF seems to be, you know, the last shot for a lot of people. You know, if your tubes are blocked and all that, you know, the only way you can conceive will be through the IVF. So and strangely enough, the IVF is not covered on the national health insurance. I don't know about the private health insurance. That one, I don't know much about that, but the services of the IVF too is very expensive. Like, I think probably one trial of IVF, I think it's averagely about 25,000 or so. And
yeah,
it's quite expensive.
25,000. What's the currency? Dollars or
Ghana
cedis?
cedis.
Oh, yes, Ghana cedis.
Yes. Which is cheaper than probably in the States, obviously. But in the UK, you are getting that for free, and in the States too, some of the insurance companies would let you have one trial for free, but the rest you pay through your nose. It's very expensive. Yeah, in Ghana, it's about 25,000 averagely. So some people charge more, some people might charge less, but average about 25,000. And you know, with the harsh economy in Ghana and all that, you know, the small salaries that we earn in Ghana, it's a luxury to do IVF. You know, an ordinary person, an ordinary citizen, an ordinary Ghanaian citizen, public or civil servant cannot pay for that amount of money, and you need support from donors, or from or maybe from other charity organizations or something like that, to be able to cough up that amount of money. And you know, it also has there is also the religious aspect to it, you know, because culturally we frown on IVF, even cesarean section. Culturally, some mothers will not allow their kids, their daughters, to do cesarean section, because they feel that they have to go through the rigors of labor, and you know, if you do cesarean section, you are in quote less of a woman, you know, that kind of thing. So it's the same for IVF. I mean, some churches will frown on it. They want you to go the natural way and try the natural way. Even if you have the money to do it, some churches will even frown on it. But I mean, that's a discussion for another time.
So I think it's.
But basically, it's an expensive procedure. And I mean, what Whitney is doing is very laudable. If you can get more of such organizations to help the women, I think it will be something good for the country. Or even if they could get it under the national health insurance scheme, maybe you can get one trial for free. Yeah. If you can get one trial for free, then it's going to be something which is going to be very good for the country.
One last point before we move on to insurance. So with things like plastic surgery, a lot of people might go to Turkey to get, you know, hair implants, or to get some form of enhancements to their bodies, because it's cheaper and nobody intends to die there. So they clearly trust it to some extent. And you know, with the Black Lives Matter movement in the UK, statistically, that women are five times more, Black women are 5 times more likely to pass away of certain things than their white counterparts. So naturally, you think things are cheaper in Ghana, and then the majority, 99% of people that the doctors treat are Ghanaian. So therefore, the success rate must be higher with like my body, my physiology. So would it be thinking, black and white in a sense? If I've got 3,500 for IVF treatment, if I've got the money and I'm moving to Ghana, should I stay in the health system in Ghana because you treat more Ghanaians like me, or should I move to the UK, or should I, come back to the UK and do it there? If money is not an issue for me, where should I go?
Um, this quite an interesting and dicey question. But as I said earlier, the Ghanaian doctors are, Ghanaian trained doctors who work in Ghana, they are highly competent. I mean, if at times we have visiting doctors from other countries, from the UK, Canada, US, coming into Ghana, and when they come and they see the kind of facilities available to the doctors in Ghana and the kind of conditions in which they work and the kind of things they are able to do, they are very much amazed. They are very much amazed. So what I can say is that Ghanaian doctors are very competent. So much just like what you find in the UK. But the difference is that Ghanaian doctors work under harsh conditions, and they work under, facilities where they work in facilities where they are, where they are inadequate, facilities to work with. So, in order to get a good healthcare system, the facilities should be available and it should be accessible. So if you have the facilities and it's not accessible to the patient, be it, the patient lives, let's say, 20 kilometers from the facility, then you are not making any headway. And if you have the facilities and it's not affordable to the patient, then you are not also making any headway. You can have all the facilities, but very expensive. Nobody can afford that. So it will just be sitting there, white elephant. So what I can say is that Ghanaian doctors are highly competent, but most of the hospitals are, most of the hospitals which are easily accessed or easily accessible by the ordinary Ghanaian are government hospitals. The government, would have to put in more. We have to put in, kind of put in more money and get the facilities, the equipment that we need to be able to deliver healthcare equitably to everybody. So if you have your 3,500 British pound and you are thinking of coming to Ghana to do your IVF or doing it in the UK, I could say that there are a lot of fertility clinics in Ghana with very high success rates. Some of them, when they talk about their success rates, you'll marvel. Some of them are doing very well.
That's good to know that.
Yes, some of them are doing very well, but it all boils down at the end of the day to money.
To money, okay.
Yeah, it all boils down to the money.
Okay, Effie, I want you to answer this question. Thank you, Kay. I want you to answer this question. In regards to, so Kay's been saying that, the doctors are great. It's not the competency of the doctors, and it's the workload and the patient ratio. So a few people have asked, one,
at the facilities,
are there healthcare assistants? The facilities, okay.
Yes.
So healthcare assistants, how are they in Ghana? And then also, are there any initiatives or any drive to push? So in the UK, when there's a shortage of teachers, they promote it, they give teachers, extra money and all those things to incentivize graduates to become teachers. Obviously, it's harder for doctors, but I suppose even with Ghana, there may be a lot of doctors that train, but then a lot of doctors probably leave the country, and there's that brain drain there. Is there any incentive that the government is putting in to increase and better the ratio, Efia, that you know, not that you're from the government?
As far as I know, there was a recent strike by the doctors to increase like allowances and give more incentives. Like I know giving cars to some of them that are higher, like some of the specialists, some of the consultants and things like that for the doctors, but not for the nurses. What I know for the nurses is that they get like a government allowance and while they're in school. So this is to encourage more of them to go to school so we can train more. But the thing is that in the end, a lot of them are not employed. A lot of them are sitting at home. And with my experience in working at Kolibu, we don't have, apart from the nurses, we have these health aides. And some of them help with like gathering the medication for the nurses to serve. Some of them help with giving bed baths. Some of them with feeding the patient, but they're not that common, and um, they're not very many. So you find that the nurses themselves are doing a lot more of the work. And then within the nurses, we have like matrons, we have senior matrons, things like that. They have these like different colored belts and things they wear. So as you go up or as you rise in the rank, you do less of like the bathing of patients and serving medication. So you find those that are straight out of school doing a lot more of the work. But we don't have healthcare aides as far as I'm concerned. We have aides, but they don't do so much. They don't necessarily serve to reduce the workload of the nurses. I saw someone post in the comment section that that's what's being done in the West, and that there are healthcare aides to help reduce the workload of the nurses. But we don't have many of those around. Those who come around sometimes are even those cleaning, and then they offer help to the nurses to do certain things. That's as far as I know.
Okay, I mean, so to add to what Doctor said, there is this program, physician assistant. So the physician assistantship program is quite new in Ghana, but I know in the US it has been in the US for so many years now. In Ghana, it's something that is quite new, and I think it has been in existence in Ghana for about 7 years now, or something like that. So you have people training as physician assistants, and it's a 4-year course, and they are kind of in between. So they are above the level of a nurse, and they are below the level of a physician. So they are kind of in between. And normally those physician assistants are, I think the purpose of starting that program is to get these professionals to serve in the deprived areas of the country. So if you go to the rural areas, their district or their rural health center or something would have a physician, should have a physician, at least a physician assistant should be present there to see to, normal small first aids, see to simple emergencies, and then refer to a bigger facility. And then I remember during President Kufuor's time, they were training they used to call them, I've forgotten the name, but they were training some category of people. I don't want to use the word nurses because they are not trained nurses, but they were training. They used to call them the ward assistants or something like that. They used to wear this uniform.
The brown uniform.
No, brown uniforms are community health nurses. Yeah, those ones are community health nurses. But this one they used to wear, it was like checked red and white or something like that.
Okay, I've not come across that.
Yeah,
I've seen pink.
I think yes, pink or something. Yeah, pink. Good. Yes, pink. Yeah. So they used to get 3 months training, and then they come out 3 months training in how do you call it, in a nursing school. Even though they are not giving the nursing diploma or the degree nursing, the nursing diploma, I think nursing diploma is 3 years, and then the degree nursing is 4 years, and then they have the 2-year nursing, which is how do you call them? They have this certificate in nursing. That one is 2 years, but this one is far below that level. They were training for only 3 months, so that they could help the nurses on the ward with changing the beddings, bed bath, and some other simple things that they can do in the ward to kind of free up
the stress.
To free up the stress on the nurses, so that the nurses can do the technical stuff like serving medications, feeding, and all those things on the ward, which comes with a little bit of skill. Yeah, but every government comes in and everybody has its own agenda. So I think they are phased out now.
Oh wow. We're pressed for time a bit. I want to move on to insurance because, just to remind those who have joined late, the purpose of this is to get a bit more insight on the healthcare in Ghana, and Whitney, Dr. Efwa, and Dr. Owusu have really shed a bit more light that I didn't know in terms of the fact that people come from, if they return from private healthcare, they often go back to the public one when things are not going too well. But as people are coming back or migrating back to Ghana, what's the first thing they do insurance-wise? So two sections, whether they are employed or self-employed, what are the routes for insurance, and what is the pay out of, what's the deduction, what does it look like in people's checks? I mean, as people from America would be used to this, but people in the UK are not used to seeing them actually paying for the National Health Service or their own insurance, the average person anyway. So Efre, how does it look like in the companies that we can go to?
So once you move to Ghana, you have a Ghanaian passport or you have a residence permit, you're allowed to apply for the National Health Insurance. So this is a public health insurance that's available to everyone. And that is, I think you pay 30 cedis a year. It's not much, so it's 30 cedis a year, but you can only use this in the public hospitals, so the tertiary hospitals, the clinics, the polyclinics, and most of the time, you still have to pay like a co-pay, I think that's the word. So maybe you would go to a hospital, but you still have to pay some cash for the food, or you still have to pay some cash to use like a nebulizer. They have like a maintenance fee. You still have to pay some cash. Say you are getting a band, you broke your leg, or you have a scratch or something, and then they have to suture, and then you have to get bandage or something like that. You may have to pay extra for that. But without the health insurance, you pay a little bit more. But the thing is that, and I think you asked me before, you can have the card physically. Now we are moving on to like renewing them over the phone. But then when you get to the hospital, you actually need several photocopies of it, which is like the most annoying thing.
Wow.
You need to have several photocopies and present them at several points. I mean, you'll be seen. By the time you're leaving the hospital, you should have done this process, made photocopies, taken it to, it's like a very annoying runaround that you have to do. So that's a national health insurance. So for the private health insurance, as far as I know, I tried to get someone to speak with us, but it wasn't possible. I know that they don't have ones available for an individual not affiliated with an institution. So if you were to come and have like a startup, I think with a minimum of about 15 employees, you could have a private health insurance. So I was on my dad's. He has his own company, and I think he had 15 or more than 15 workers. So he got that health insurance, and then with that, you could have beneficiaries. So I was on my dad's, and then my mom, and then my brothers, and that didn't even have an age limit. So even at this age, I could still be working. I could still be on my dad's health insurance, but it was very expensive. I think it's something he's thinking of actually discontinuing. And as I said earlier, the health insurance, the private health insurance, there's different ones. So this was nationwide. There's Medex, there's Affix, there's so many different kinds, which different companies use. And they don't take it in every hospital. So you may think that, okay, I live, say, in Isegon. The closest private clinic is maybe a Boa hospital or something like that. You may get there with your private health insurance, but they may not take your kind. They may take another private health insurance, but they definitely do not take any national health insurance. So what you need to know is that there's a national health insurance available for if you're a Ghanaian or you're a resident. The private health insurance, if you're employed by a company, you may have access to it. If you're doing a startup, you can purchase it for yourself and for your employees. But just mind you that it will not be accepted in every single facility. So you need to look up. I know when we were applying for it, we looked up the facilities that were able to take this health insurance, yes. And then I know from my husband's company, they don't even have a health insurance, but they have like an agreement with 2 or 3 clinics. And so if you were sick and you went to those clinics, they'll just put your name down and then they'll bill the hospital. So that's the kind of thing that goes around. So, I mean, even if you were to have a startup and maybe then private insurance is a bit expensive, you could talk to 1 or 2 private hospitals and get an account with them, that sort of thing. But once anything moves beyond outside the hospital, you would have to foot the bill yourself. Like say you needed to be referred to a public hospital to see a specialist that wasn't at the private hospital, you would have to probably pay for that out of pocket. So that's the thing. Go ahead.
So, for example, if I set up a company and I had 15 employees, how much of the burden is on me as the company? And if you can give us a kind of a round figure of how much it is for your family, so then we can kind of know what the figures are.
Okay. I think so. It depends on how you, the employer, decides to do it. But I think how it worked for my dad's company, there wasn't any burden on the staff. It was something he took up wholly for his staff. So there wasn't a deductible at the end of the month or anything like that. And then they could actually have their wife and kid on it. And I think it cost somewhere like 30,000 cedis a year, 30 to 50,000 cedis a year. I can't really remember. And then even that, at the end, they bring you something based on your usage. So you can kind of go over. Like I know when I was pregnant and I was going to deliver, I was going to a private hospital before I started going where I was working. And the lady kept saying that, oh, we have a limit. So depending on by the time you deliver, we'll check and see how much of it you've used, that sort of thing. So there's a lot of fine print that you need to go into when you're going into agreements with the private health insurance. But it's expensive. It's expensive. And
so you said around 30,000 for the whole of, for example, cities for your dad's employees.
Yes,
for example,
so for
and all their family members.
Yeah, and their dependents. I think you can have up to like 2 or 3. So like your wife and 2 children. So they have like a limit. So this is nationwide. I don't know how the other health insurance work. The other private ones, I don't know how they work, but this is nationwide. So, but the national health insurance, that everybody needs to get like an individual one. And so like if you're a mother, for your child, you can use it for your child up to 3 months. And then after 3 months, you have to issue a card for your child.
Right, okay. Whitney, regarding insurance for people going through fertility, and they find that, as if you were saying, if I find that one hospital couldn't really deliver my needs, I didn't like the way they treated me, emotionally, as Dr. K was saying, could I then I started care with on one insurance in one clinic. Could I then transfer to another clinic, or how does that work?
Yes, you can. Once you talk to your insurance company, you can do that here. That can easily be sorted by your insurance company, but you need to do a formal letter on that you have moved from this facility to that facility. And they have to, the other thing too is then whichever facility you're going to choose has to be on their list, because bear in mind, it is not every facility that's on a certain insurance company's list. So you have to have that in mind as well. But you can do that once they are on there.
God forbid somebody has cancer, but they have it quite late. Could they then get insurance? So, in like normal insurance processes, if you've broken your car, you can't then get insurance for a good car. So if God forbid somebody has cancer, could they now get a clean health insurance and then use it? Or do they really take into account, are you a smoker? Are you this? Are you that? Are those things that they kind of penalize you for? So if, for example, if you want like fertility treatment on a new insurance, will it go higher? Will your premium be higher because you are 35 and you've tried 2 IVFs already, or that those things are not really
No, those things do not count. As long as you have, and most of these insurance companies do all this pep talks with you before you sign on, so you know exactly what you're signing on for.
But they don't charge me more because they know that I will need to use it more.
No, they don't charge you. I think it's about the same cost, except probably then you are now going to add on another service, say surrogacy, or you're going to do something else. But if it's along the same fertility treatment, they don't charge you.
Right. Okay then. Okay. Thank you for that. If your last question in terms of insurance, if you wanted to, so you mentioned group insurance. Are there ways in which you can then just privately get insurance? So I'm by myself. I I just want insurance for myself. Is there a way I can do that without the affiliation?
As far as I know, the private health insurances are not available for individuals. It has to come as a group. So under a company, I don't even know if it could come as like a group of friends. No, I don't think so. But as far as I know, I don't know if there have been any new developments or any newer insurances that are taking individuals. Yeah. So especially for the private, but for the national health insurance, yes, that is done individually.
Okay. I didn't know that at all. Okay, I think we're going to close now because we're over time. But thank you so much, all three of you, for joining. Just want to close with the other time I close with what people are listening to and who their favorite Ghanaian person is. But what's the one thing that you'd want to tell us about the Ghanaian health system that we didn't know? Pleasant thing, a good thing that we didn't know about? Give you a pleasant story or anything positive that we didn't know that we should know. So, ladies first.
For me, doing my dear sister's keeper, I have come to realize that there are some amazing fertility doctors out there who will go the extra mile for patients, and that's very encouraging. It's I'm always happy when we get rainbow babies, when couples finally have the baby they longed for, and they're so patient. Whatever time, whatever day anybody calls them, they are readily available. So that I am thankful for our community doctors, our psychiatrists, our counselors, and everything. I'm so thankful that we have this group of people who make it happen for a lot of families.
Okay,
Thank you. Over to you, Dr. Efia. Oh,
yeah, so
okay,
I would also want to.
Oh, okay.
I would also want to drum into everybody's ears that Ghanaian doctors are highly competent and they are good at what they do. The problem is that we don't have the equipment, we don't have the facilities. I mean, government officials will prefer driving in Land Cruisers V8s than funding the hospitals. So these are some of the challenges that Ghanaian doctors face. When it comes to competency, yes, they know their job, they are very good at it, but you are forced to work under hard conditions. You are always forced to improvise, to be innovative as a doctor and improvise on certain things to be able to deliver the care that you are supposed to give, because probably what you actually need, the equipment you actually need to deliver that service is not there. So you need to kind of improvise, to be able to deliver what the kind of care that you are supposed to deliver. So I mean, because I know that there's a lot of perception out there, outside the country, especially those of you who live outside the country, that maybe Ghanaian doctors are probably substandard or something. But they are very competent. They know their job very well. But the problem is about the facilities. Because as we said, it's the same doctors you meet in the government hospital that you meet in the private hospitals, and you kind of get some satisfaction in the private hospitals as compared to the public hospitals. And it's the same group of people. So yeah, so that's what I have to say.
I don't know whether that was very positive or not. You just shifted one lack of incompetency from one thing to another. But okay, it's good to know that doctors are not.
So the doctors are very competent.
Yeah.
You see, but it's kind of, your hands are tied because of the facility in which you work, because there are a lot of things that they are not, that there are a lot of logistics, or there are a lot of consumables that are not available to you to provide that work. But if you move to, let's say, a private hospital where those logistics and those consumables are available, you see, the output is great.
Yeah. Deliver.
Yeah, that's what I want to say.
That's
No,
what I was
understood.
going
Over
to
to
say.
you, Edgar.
Oh, yeah, that's what I was going to say, that everyone should just have a little bit of faith in the Ghanaian doctors and that they are very, very competent. So that's basically it. And everything Dr. Peku said is true. Once we have all the facilities we need to, you'll see that we'll even be more amazing than the rest.
Yeah. I think that's a push for people to donate and stuff. I think someone wrote, expatriates are allowed to sign on individual insurance covers. They are little expensive. So that's something for us. But thank you so much for joining us. We do have a group, which is a WhatsApp group, and hopefully expand into a wider community just to provide a bit more support for people that want to migrate and give them the full understanding of what it is. So like you said with insurance, how much does it cost? If it's expensive as a group, if it's in your company, all those things, and the trust. Sometimes the placebo effect in itself, if you don't trust the doctors, you might even not get better because you don't think that they're giving you or telling you the right things. So thank you so much. And I will share Whitney's initiative that she's doing. If anyone wants to donate or support or recommend a loved one in Ghana or abroad that wants to use their services. But thank you so much for your time. Have a good day, everyone.
You
Okay.
too.
You too.
Bye.
Bye.
Bye-bye.